Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me on your program.
Thank you, sir. I just wanted to ask you to begin with some of the regions that we've been monitoring for a little while now. Could you give us an update on those?
Well, we do have some areas of interest, and one of those areas would be in Warramadong. As you know, we have identified a number of cases there. As of today, we still have 44 active cases in Warramadong, so that's an area that we continue to monitor. We have a medical team in the area, and they would be going to different parts in the Mazaruni to not just check what's going on at Warramadong, but going to some of the other villages to ensure that persons in those villages are not positive as well. So that's work that is ongoing. And of course, in Region 9, while we have been relatively quiet in terms of our cases, because of what is happening in the neighboring state of Roraima, we continue to have very close monitoring, and we have established a system whereby we are constantly checking to make sure that we're not missing any cases. So right now, things are quiet, or relatively quiet, but it's an area that we have great interest in monitoring because what is happening in our neighboring country.
Okay, thank you. Yesterday in the National Assembly, you made a major announcement that Ghana would be getting 149,000 COVID-19 vaccine. This is through the CARICOM African Union PAC. Could you share with us a little bit more about this?
Well, the African Union and CARICOM has broken an agreement whereby the African Union has allocated 1.5 million doses of vaccines to the Caribbean. And CARFA has provided to CARICOM, I suppose based on the population of the different countries in the region, a breakdown of how many doses they should allocate per country. And so based on that schematic that CARFA would have presented to CARICOM, Guyana has now been or designated to receive at least 149,000 doses. These vaccines are not going to be free. They are vaccines that the country would have to pay for. And right now, we have indicated our interest in receiving vaccines through this mechanism, and the details are currently being worked out between CARICOM and the African Union. So as we get those details, we will be able to update you.
All right, and this of course adds to what we already have from the Chinese government, 20,000.
Yes, from the Chinese government, we are getting a donation of 20,000 Sinopharm vaccines, and of course, you know, through the COVAX facility, COVAX is expected to start rolling out vaccines to the different countries that are part of the facility. They're using the AstraZeneca vaccine as one of the main vaccines to be given. And they're hoping that the WHO would grant emergency use listing by the middle of this month. And once that emergency use listing is given, that they would start rolling out the AstraZeneca vaccine.
All right, if I can, in terms of the vaccine that we're going to get from the African Union, I know you said the details are being worked out. Do we have any idea as to which one of the vaccines it would be?
I think they might have access to the mRNA vaccines, which would be Pfizer, Moderna, and AstraZeneca vaccines.
Okay. All right, thank you. All right, so our COVID-19 vaccine education. So can someone take all the medication for any side effect they may get after taking the COVID-19 vaccine? Yesterday you spoke a little bit about it.
As I said, we can divide the side effects into two groups. The first one being the minor reactions that one would have when you get an injection. And those would be at the site of the injection. You can get a little bit of pain, you'll get some inflammation, some redness, um, some soreness in the arm. So these are common things that people would experience. Some people might get a little bit of fever and so forth. For those, there's nothing wrong with, you know, most people might take a painkiller, and that would then ease the pain. Some people might take something for fever. So generally, people would do those things. And these are all over-counter medication. They don't have any um, serious, uh, you know, effects on. They would, of course, help to alleviate the pain or the fever that one is experiencing. But these minor side effects that you'll get from vaccine, that some people would get from the vaccine, would go very quickly. So I think for most people within a 24-hour period, all of these things would disappear. And the other category of side effects would be what is called adverse side effects, meaning that they're very rare. Um, Maybe 1 in a million person might get it. And so, because of its rarity, um, you know, we don't anticipate to have many of those. Nevertheless, our staff would be trained to detect any such event. And if somebody is given the vaccine, they'll be monitored to make sure immediately after receiving the dose, they'll be monitored for about half an hour, and then they're allowed to go. And then we continue to monitor them because we would give them information that if anything develops that they feel they need to report, then they can call a specific hotline, and we'll take those reports and we'll be able to give them some assistance if that is necessary. We don't anticipate, as I said, because it's such a rarity, we don't anticipate any kind of, you know, major cases, but nevertheless, we are planning just in case we have them. And that's how these things work.
Okay. My next question, if someone does not get any side effect after taking the COVID-19 vaccine, does that mean that it did not work on them?
Oh no, the when you get the vaccine, it will take some time. The vaccines really are going to trigger a response from your immune system. So, in most cases, these vaccines that are being given, they are two-dose vaccines. So, in some cases, you have to get a second dose after 21 days for some of the vaccines. In other cases, you get a dose at 28 days, right? So, after you get the first dose, your body immune system starts reacting, and it would produce what is called antibodies. And these are things that are necessary for us to fight off any infection, right? Um, so it takes a while for that set of antibodies to develop. And then when you get the second dose, it even boosts the production of the antibodies. So rather than, so the first dose, let's say it goes up a little bit, and with the second dose, it gets even higher. So now your body is really primed after that second dose to take on any infection. So, you know, after the injection that you get, if you don't get any side effect, that's okay, right? Because it takes a while for your body to develop the antibodies that would respond to any of the infections that you might come in contact with.
Okay. Well, that's why they call the second dose the booster shot.
Right.
All right. All right. My last question on the vaccine education. Can the second dose of the COVID-19 mRNA vaccine, as you mentioned, be from a different company?
But generally, no. What both Pfizer and Moderna, the manufacturers of the two mRNA vaccines, they have said there shouldn't be any mixing of the vaccine. So if you get a first dose Pfizer shot, you should also get a second dose Pfizer shot. If you get a first dose Moderna shot, then a second dose Moderna shot. And there have been some discussions with the expert group by WHO, and they are also recommending that. I was in a meeting with that expert group and with Pfizer when their vaccines were being discussed by the SAGE. And Pfizer recommended to the expert group that there should be no mixing. And I think those recommendations have since been put out in various clinical guidelines, and that is what is being adhered to.
All right. It actually reminds me earlier, a few weeks we had spoken, it could have been a few months ago, when you talked to us about training of staff and the record keeping, why it was necessary. So we understand now why.
Yeah, yeah, and not only that, you know, when we give a vaccine, we also have to trace the serial number of the vaccine, which batch it came on, and so forth. So it's a very comprehensive record keeping, and the staff is trained to do that so that we can always check with our records to see what's going on.
Okay. Well, Minister Anthony, thank you so much for speaking with us.
Thank you.
Okay. Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.